Welcome. My name is Jeff Berkey, and my co-creators, Tony Stefan and Brian Johnson, would like to take this opportunity to thank you for viewing our MBA625 Group IT project for summer 2014. I have the privilege to introduce our project's background and relevance, and ultimately the information technology issues that we will address during the presentation. Our project focuses on Humility of Mary Health Partners, also known as HMHP, and their commitment to a successful implementation of a clinical integration network that initially began in July of 2013. Over the past 100 years, HMHP, located in Youngstown, Ohio, along with their parent company, Catholic Health Partners in Cincinnati, and her sister hospitals, Mercy in Toledo and Community Health in Lorain, all of which operate under the same mission of clinical excellence, combined with unsurpassed service in an atmosphere of comfort, individualized attention, and spirituality. This slide offers some key facts to gain a better understanding of the scope of HMHP. We can do this by noting the sizable numbers of medical staff members, hospital admissions, and patient days for fiscal year 2012. HMHP began Lean Six Sigma principles in February of 2007, when 30 staff members were trained as Lean facilitators and Six Sigma green and black belts. These individuals developed skills in team facilitation, change management, and Lean concepts. Each facilitator leads a team of frontline staff members. The teams map each step in a process, then they analyze each step to determine if it adds value to the process and is performed in the most efficient manner. From this analysis process, changes are designed, tested, and evaluated. Those changes, if found to be successful, are then put into everyday practice. The diagram shows the 7 components of a clinically integrated network. A clinical integration network is defined as a health network working together using proven protocols and measures to improve patient care, decrease costs, and demonstrate value to the market. HMHP modeled their implementation process from the guidelines written by Dennis Butts, a manager of healthcare strategy practices, that explains the strategies for developing a clinical integration. They include the following: cultivate physician leaders. A successful clinical integration strategy requires the integrated network to be physician-led and physician-driven. Provide hospital management. Creating a physician-led clinical integration network does not mean clinical integration is solely run by physicians. However, the most successful programs have embraced a physician-led, professionally managed culture that maximizes the experience and expertise of physicians and hospital administration. Communicate often. Another critical aspect of clinical integration is frequent communication between all parties. Clinical integration is a major change initiative, and leaders should seek medical staff input early and often. Choose matrix. Clinical integration networks should choose matrix that span the continuum of care. Make sure your matrix cover the inpatient side as well as the outpatient side. Invest in infrastructure. A successful clinical integration network requires investment in infrastructure that can connect the hospital and physicians through patient registries and other electronic systems. Determine a distribution method. Leaders must develop a methodology to distribute incentive dollars once they are in the network. The distribution methodology should distribute funds based on measurable performance, be transparent, reward physicians for their individual contribution and performance, and maintain a level of simplicity. The value equation revolves around the information technology platform, which includes timely clinical information assessed by multiple providers across the care team, clinical decision support based on evidence-based guidelines which are agreed upon by the organization, measures of compliance with guidelines and quality outcomes at the provider, practice, and network levels, along with physician performance benchmarks. HMHP has contracted with Explorus as their third-party cloud computing platform service provider. Founded in 2009 as a spin-off from Cleveland Clinic, It has earned the reputation as the most powerful healthcare computing platform in the world. Explorers provides a secure software platform that allows healthcare systems to aggregate, analyze, manage, and research their big data to provide better patient care at a lower cost. The typical patient visits many care settings, including ambulatory, acute, long-term care, rehabilitation, home and specialty care. Explorers applies a broad approach to data collection within these venues while supporting a wide range of data sources. The Explorer's cloud computing platform offers turnkey solutions for reporting, analytics, clinical integration, at-risk population management, and pay-for-performance solutions. This slide illustrates the Explorer's dashboard used by the physicians and their staff. To ensure privacy and confidentiality, each participating location can only access the practice in which they share an association. Take a closer look at some of the patient's details listed on the dashboard. We see the name of patient, gender, date of last visit, the date of their next visit, along with their insurance provider. The integration process begins with the entire group of participating practices and physicians receiving in-house training and support for navigating the Explorer system. As soon as training is complete, the participants are off and running, collecting relevant data that is to be submitted into the Explorer's program. Next, the participants are given two options in which to complete a billing data transmission. They can file once a week or once a month, depending upon their particular practice's billing cycles. These 837 transaction file transmissions are then integrated into the Explorer's application. Just to clarify, an 837 transaction file is an insurance claim submitted to the insurance providers. The 837 transaction set is the format established to meet HIPAA requirements for the electronic submission of healthcare claim information. The claim information included amounts to the following for a single care encounter between patient and provider: description of the patient's condition for which treatment was provided, the services provided, and the cost of treatment. Then, at 30-day intervals, a process occurs to ensure proper integration of the collected data has been loaded into the Explorer's grid by all participating locations. The integration will include a foundation of both an internal and external processes for adding and deleting practices with little effort on the part of the system user, an ongoing or repeatable file transfer process, the establishment of minimal hardware and software requirements, and the publishing and distribution of systematic instruction manuals or quick reference guides that can be obtained online. During this time, the client takes full responsibility of performing a measure of validation once the 837 transaction file data is loaded into Explorers. And lastly, a security and authentication protocol will transpire in the Explorer's electronic project management application. In order to grasp the complexity involved, this slide depicts the 7 steps required to process every 837 transaction. These are just some of the positive results that HMHP hopes to see as a result of the integration process. One task that HMHP cannot afford to overlook during and after the implementation process is the IT audit. Risks are determined within the contextual circumstances to the entity and includes the business, its own business processes, project management, and the economy. In addition, auditors need to have a firm grasp on cloud computing and software as a service technologies in order to establish an approach for identifying key risks. I want to take a moment and comment about controls so not to cause any confusion. Controls are the effectiveness and efficiency of operations in compliance with applicable laws and regulations, and they must be in place to ensure data security, reliability, and integrity. Also, it is vitally important that the controls extend to any outsourced service providers, such as software as a service and data hosting facilities. As with any type of outsourcing of data, the organization must prepare themselves to acknowledge potential risks that could occur. I cannot stress enough the importance of regulatory compliance. The regulations require organizations to document and manage business processes, as well as implement technologies that furnish access control, security, and change management. The auditor's examination, performed in accordance with the SAS 70 audit, certifies the service organization has been through an in-depth examination of their control objectives and activities, which often includes controls over information technology and other selected processes. For nearly 18 years, the SAS 70 has been the authoritative guidance that allowed service organizations to disclose their control activities and processes to their customers and their customers' customers. In order for an IT audit to be considered effective, it must systematically travel through many steps that include project planning and management risks, mitigating controls, and auditing risk objectives. Risks are always a possibility, especially when dealing with any form of collection and transfer of confidential data, and unfortunately, they are not going away anytime soon. So it is up to the organization to take a proactive approach by developing a framework that anticipates what type of risks may occur and the process to eliminate them from happening in the future. Now that I've explained some of the issues surrounding the implementation of a clinical integration network, Tony will guide us through the next phase by explaining the IT risk analysis.
Thank you, Jeff. As you stated in the previous slide, every aspect of risk deserves consideration. Therefore, the next important step of this project is to perform a complete risk assessment. Risk management lacks effectiveness if done on an irregular basis, or worse yet, conducted only once. An ongoing assessment ensures both planned and unplanned threat identification efforts and enables proactive risk mitigation. A thorough risk assessment will show us where we are, where we want to be, and what we need to get there. CARE Network is a network of physicians who have decided to collaborate with HMHP in delivering evidence-based medicine and improving quality, efficiency, and coordination of care. They have identified metrics and targets designed to meaningfully impact the clinical practice of all physicians in the network. This quality program is to improve value across the whole continuum of care. The performance improvement architecture consists of database mechanisms and processes to monitor and manage utilization of healthcare services designed to control costs and ensure quality of care. At this point in the project, the CIN has grown to include around 340 physician members. Of those 340 members, approximately 240 affiliated physicians will need to be remotely connected to our business intelligence tool, Explorus. Currently, there are only two options for this connectivity. Option 1 is utilizing CPT2 codes to identify quality measures the physician has performed. The physician or his coding staff will include the CPT2 codes on the practice's 837 EDI billing transmissions. Using a secure FTP application called MoveIt, the practice can upload their 837 EDI files to the Explorer server, where they will be extracted and ran through the measures for compliance. The second option available is a direct interface with the practice's EHR to collect discrete clinical data. This option can only be used if Explorus has written an interface for the practice's specific EHR application. Explorus is still working through the process around this option. Our goal during this assessment is to not only identify and mitigate risks, but to follow the FTC clinical integration requirements. To be considered a legal, clinically integrated network in the eyes of the FTC, HMHP must fulfill all the requirements that are listed in the complete project report. The following 3 slides are a brief synopsis of those requirements. Proof of concept or program readiness can be reached when we are able to demonstrate that HMHP has created an effective information technology infrastructure around the CIN. The FTC does not consider strategies, plans, or mock-ups at the proof of concept level. In addition, because Explorus is a vendor, we will need to continuously monitor them for both risk and FTC compliance. As an example of proof of concept, I have included the requirements for data acquisition and aggregation that are listed in the risk assessment section of the report. The items listed on this slide are all considered high risk and necessary to maintain our CIN qualification. Most of the requirements listed will need to be fulfilled by the Explorers team, which amplifies our commitment to closely monitor their progress. You can refer back to the project report to review the current status and recommendations for each bullet listed on this slide. I felt as a team it was imperative to review another major requirement we must obtain for FTC proof of concept. That is the completion of the information system infrastructure. As with the previous slide, you can see that the majority of this section's high risk rests with the Explorers team. In addition, a table of Level 2 risks with classifications can be found in Appendix A of the IT project report. I would like to point out that even though the last bullet states, Explorers must have a high degree of confidence of a full implementation, it is still the responsibility of the HMHP project management team to mitigate the risk and complete the Care Network project on time and on budget. Last, we must remember these three takeaways. First, be aware that every project has both known and hidden risks. Second, always remember that the FTC rules are the rules. And third, it is ultimately the project management team's responsibility to manage the project to a complete and FTC-compliant end. At this point, I would like to turn it over to Brian Johnson, who will handle the financial aspects of this project.
Thank you, Tony. Good afternoon, everyone. As mentioned earlier in this presentation, HMHP, which is located in Youngstown, Ohio, has elected to partner with Explorers, which was founded in 2009 by Stephen McHale and Charlie Lougheed. Explorers is a spin-off of the Cleveland Clinic and is an industry leader in leveraging big data. Before deciding to partner with Explorers, HMHP interviewed several competitors of Explorers, such as Humedica out of Boston, Massachusetts, and Pervasive, located in San Diego, California. Ultimately, the location and expertise of Explorers has led HMHP to partner with them for the company's clinical integration needs. There are several expenses that coincide with the implementation of a clinical integration network. The largest of these expenses is an annual expense of $500,000 for the Explorers database application cost. This expense will be put into a prepaid account that sits on the balance sheet and is amortized to expense at a rate of $41,666 per month. All of the expenses paid to Explorers for the database application costs are minimal compared to the cost of buying and maintaining the IT infrastructure that would have been needed in order to complete this project without a cloud-based partner. The initial project will also incur some consulting expenses that should not exceed $90,000, along with travel expenses of about $8,000. In order to ensure the success of this project, there will also be 3 full-time employees hired to implement and run this program. A director will be hired at a rate of $100,000 annually. A manager will be hired at a rate of $80,000 annually, and an analyst will be hired at $65,000 annually. HMHP will also purchase a Move It application, which is an initial investment of $23,000 plus an additional cost of $2,300 in yearly maintenance. As you can see from the chart on this slide, this project is currently coming in around $34,000 under budget. The director of this project has done a phenomenal job of keeping the project on time and on budget. Although the Move It application was not planned for, it was a must-have, and the expense of this application was more than offset by the delays in hiring both the manager and the analyst. The director of this project is currently in the process of getting the 2015 plan approved. This plan is currently $112,000 over the 2014 actual spend. This is due to the planned rollout of this program to 250 doctors across the region. Due to the increased workload that coincides with the full implementation of this program, the director is also planning on hiring another analyst during the second quarter of 2015. This concludes our presentation. Thank you everyone for taking the time to view our presentation.